Schizophrenia is a lifelong disease for which there is no cure.
It is a disorder that affects approximately 1% of the general population.
Dr. Baruch is a specialist in mental health disorders and the treatment of schizophrenia.
It affects men and women equally. It starts generally in the late teenage years and early adulthood.
3 of my children have schizophrenia.
Ruth Malloy knows how challenging the symptoms of schizophrenia can be for both those living with the disease and their families.
You have to learn to live with them. And especially if you're the family, you learn to remind people, of things.
There are many symptoms that individuals with schizophrenia have. They can be categorized as the positive symptoms. Those are the hallucinations, where they hear voices, where they feel suspicious. The negative symptoms, where there's a lack of motivation, a lack of interest in doing things. The mood symptoms, symptoms of depression, anxiety, and then the cognitive symptoms. And the cognitive symptoms are where there's difficulty in terms of learning information, new information, processing information, planning. The symptoms that are the most debilitating are the negative symptoms, the lack of interest and motivation, and the cognitive symptoms.
The negative symptoms are something that really drives families right up the wall. In fact, I think they're more responsible than the positive symptoms for what happens when families just give up.
Dr. Baruch believes that early diagnosis and treatment can significantly affect the overall quality of life for people living with schizophrenia.
The treatment of schizophrenia has several dimensions. The most important part in the treatment is the medication. It is important for individuals to take the medications regularly, consistently as prescribed, and of course, supportive measures for the individual and family as well.
Treating patients with schizophrenia can be challenging.
One of the biggest hurdles is to have the patient accept their illness and that they do need treatment.
Another challenge is that side effects can cause some patients to stop taking their medication.
The side effects that are most common are the weight gain, the sexual side effects, feeling sleepy, and some of the movement disorders, which can be stigmatizing. The positive part is that there are many different medications, and if you have side effects to one medication, you can always try another medication, and you may not experience those side effects.
But as new treatments are developed, it can take up to 2 years for them to be approved for public funding.
The majority of individuals with schizophrenia rely on formulary coverage for their medications. They do not have third-party insurance. It is difficult to have access to some of the new medications which have considerable advantage in terms of side effects.
Physician and family support play an important role when it comes to navigating through all of these obstacles.
The family is the biggest resource that the treatment team could possibly want. They love this person, they want to see them well, they will do anything to get them that way. They're all compliant with their medication and they're all living independently, and I'm really quite proud of them because schizophrenia is not a very nice thing to try to cope with.
It is a team approach, but the goals that can be achieved are people can go back to school, individuals can work, you can avoid rehospitalization, and they can do all the things that the rest of us want to do: have relationship, have a reasonable place to live, feel good about themselves, and feel productive.